Have you ever had a plantar heel pain patient that 6, 9 or even 12 weeks later hasn't resolved or is even worse than when you started? Well, I have, and I can tell you that dealing with unhappy, dissatisfied patients is just no fun at all. If you'd like to know a surefire way to test your treatment pathway before a ton of time, effort and cash has been invested, then welcome, you're in the right place. This video is for you. G'day, I'm Jedynak, international educator and health practitioner with over 30 years clinical experience treating MSK conditions of the lower limb. I help foot fixers, podiatrists, physios, chiros, osteopaths and other physical therapists take their skills and expertise to the next level so that they can get the clinical breakthroughs their plantar heel pain patients expect. This fourth blog in a series of 8 is about shortcutting your path through the conflicting research, complex issues and unpredictability that surrounds plantar heel pains. I'll take you through step by step the quagmire that surrounds this tricky condition and save you a heap of headaches. As I've explained in the previous plantar heel pain blogs, I've had my fair share of headaches. When I graduated from university in 1982, I thought root theory was the holy grail of biomechanics. Unfortunately, I wasn't Indiana Jones and the Holy Grail. Remember that movie? When it came to the Holy Grail of biomechanics, I chose poorly, and it left me as good as dead when it came to treating plantar heel pains. I thought plantar fasciitis was a tensile traction injury caused by pes planus and excessive pronation. I didn't know that the plantar fascia is almost completely avascular, and there's no histological evidence to support the notion of the plantar fascia getting inflamed. But then there are 47 potential causes of plantar heel pain, so accurate diagnosis is pretty tricky. And without an accurate diagnosis, what chance do we foot fixers have of achieving excellent treatment outcomes? And that's why we created the dramatically valuable plantar heel pain differential diagnosis checklist in the third plantar heel pain blog. Did you grab yourself a copy? Have you found it wildly useful in your clinic? If you haven't downloaded your free copy of this checklist, then you'll need to go to the previous blog, find the link and get it. By the end of this fourth blog, you'll be another crucial step closer to diagnosing and treating plantar heel pains with ease. And I promise you that what you discover in this blog will also be super practical, so you can use it in your clinic straight away. I tell you, I would have killed for this information much earlier in my career. We know that foot fixers commonly use orthotic therapy in our treatments of mechanical tissue stress plantar heel pains. But we know that sometimes the outcomes just don't get the full resolution that your patients are desperately seeking. So if you've determined through your initial assessment and diagnosis that orthotic therapy could help your plantar heel pain patient, how can you increase the odds of success in your patient's favour? Well, we're going to go through 2 crucial things in today's blog, and we're going to comprehensively answer that very question. First, we'll review the latest evidence and what it's telling us. And second, we'll apply an evidence-based treatment trial process so that you and your patients can be confident that orthotic therapy is a good treatment choice to pursue. So first, the latest evidence. Interestingly, orthotic therapy, it's been under the pump a bit lately. This article comparing orthotic therapy and gait retraining for patellofemoral pain has orthotic therapy coming in second. And this study on the immediate effect of foot orthoses on subtalar joint mechanics and energetics concluded that footwear did more than the orthoses. But then we have this positive news from last year that concluded orthotic therapy helped prevent lower limb overuse injuries. Okay, we understand that just as no 2 patients are the same, so too no 2 orthotic devices are the same. We'll forever be faced with the challenge of trying to quantify and compare orthotic therapy efficacy. And then there's the ongoing argument between the efficacy of prefabricated orthoses and customized devices. This respected and often cited article concluded there were no quantifiable differences between the 2 forms of orthotic therapy. So where does this leave us in our clinical decision making for plantar heel pain treatment? Roos et al. In Foot and Ankle International made the following conclusions. Foot orthoses were effective in both short-term and long-term treatment of pain. Parallel improvements in function, foot-related quality of life and better compliance suggest that a foot orthosis is the best choice for the initial treatment of plantar fasciitis. Alright, that's a tick then. I also want to quote the study by Martin et al. And their study in the Journal of Orthopedic and Sports Physical Therapy, the revision of plantar heel pain, plantar fasciitis, where they concluded the use of foot orthoses, either prefabricated or customized for short-term or long-term periods, especially those individuals who respond positively to anti-pronation techniques. Ah, see that? Individuals who respond positively to anti-pronation taping. This has been one of the fantastic trial treatments we've used for plantar heel pain and orthotic therapy, because it gives us real-world feedback on the likelihood of response to orthotic therapy before investing the time, effort and cost of orthotic devices. Low-dye taping is the anti-pronation taping method that many of us are familiar with, but I know that you may have your own unique method. So let me clarify a couple of things first about the objectives that we should be aiming to achieve with your low-dye taping. And they are to offload the plantar fascia, to limit undesired pronatory motions, plantarflex the first metatarsal, to recruit the peroneus longus muscle, and to assess the suitability for orthotic therapy. Make sense? I should think so. Now, the typical low-dye taping that's used pretty much all around the world usually looks something like this. I want to show you a low-dye version that uses a third of the tape and can be done in a third of the time, and it still achieves all of the objectives just listed. In today's fabulous freebie, you can have the links to all of the articles I've quoted, plus I'll have a link to the video demo of the low-dye taping version 10.0. Make sure you grab your copy. Using the low-dye taping to make an assessment of whether to use orthotic therapy helps so much in your assessment and diagnosis. Like, it should be standard practice in my humble opinion. I recently presented a webinar on plantar heel pain here in Australia, and one of the poll questions was, do you use trial treatments before employing orthotic therapy? And you know what? 62% of the participants said yes. But that means 38%, more than a third, don't. What the? I don't care how confident or proficient you are in your assessment skills, human variations mean that you can never be 100% sure your intervention is going to work as you expect. It's just the nature of working with human beings and living adaptive bodies. So explain to your patients, in theory this treatment should work, but you're not a theory, so let's put this theory to the test. I mean, literally say that to your patients. I've said it to thousands of my patients, and you know what? When you're transparent in your communications with your patients, they really appreciate it. They respond positively to your honesty and willing to go ahead. I can't tell you how many times this has saved my bacon. When I discovered that I could test and experiment like a true scientist in my own clinic with each patient, look, I could sleep better at night. Every plantar heel pain patient is going to vary in their response to your interventions. Tell your patients that this is just the nature of the beast, and by getting together, working together, we're going to get the best possible outcome and put things to the test. In the process, you've given yourself some room to move, and the low-dye taping, if it doesn't make a noticeable change, then you can comfortably tell your patients that this result has given you valuable feedback and it makes your next move much clearer. In effect, it's kind of like playing a game of chess, which is a game of strategy. Checkmate is the ultimate goal, just like fixing plantar heel pain is your main goal. But in the meantime, you've got to understand more about your chess opponent, their weaknesses and strengths, and explore the strategies that will get you to your goal. It's just exactly the same with plantar heel pain. For each individual patient, you need to know what key strategies are going to work for them. As a practitioner treating plantar heel pain, it's crucial that you give yourself some wiggle room. Communicate clearly with your patients about the individual nature of plantar heel pain and how you'll be investigating the best strategy to beat this problem through specific testing and trialing. Look, if you only take one thing from today's blog, it should be this. Commit to doing trial treatments first for your MSK interventions, particularly orthotic therapy. It'll save you a heap of headaches for sure. If you're already in the habit of doing trial treatments first, you know exactly what I'm talking about, don't you? Cool. Hey, in next week's blog, I'm going to reveal a second trial treatment for plantar heel pain that I discovered only a few years ago. It was a game-changing experience for me, let me tell you. It involves not treating the plantar fascia. Can't wait to show you. Thanks for watching this video, and thanks for your interest in getting more predictable outcomes for plantar heel pains. It's truly inspiring to be with health practitioners who make it their mission to get the breakthroughs that help more people like never before. Please make sure you download the fabulous freebie on orthotic references and the low-dye taping that uses a third of the tape in a third of the time. See you next week for more battle-tested plantar heel pain shortcuts. Ciao.